curb your enthusiasm in
Yeah. I'd like to call the January 26, 2026 Board of Health to order. I'm asking for a roll call. Clerk?
Supervisor Gold,
Here.
Commissioner Adams, Commissioner Coyle,
Present.
Commissioner Stewart,
Here.
President Litz,
Present.
Vice President Streaker. Here. Commissioner Sheehy, Commissioner Thomas, Dr. Nguyen.
I'm here.
Okay, we have a quorum.
Okay, can we all please rise for the Pledge of Allegiance?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next item is the call to the public. Do we have anyone that wishes to speak at this time? Seeing nobody coming forward, we're going to close the public hearing portion of this here. And the next order of business is a proclamation that we have before us, and it is the proclamation recognizing April 6th through the 12th, 2026 as National Public Health Week in Mojave County. And it's to promote the awareness and public health initiatives and the importance of community health. So I'm going to proclaim April 6th through the 12th, 2026 as National Public Health Week in Mojave County. Does the board have questions or comments at this time?
Motion to approve.
Second.
So we have a motion and a second on the floor. All those in favor say aye.
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 Opposed, same sign. Well, that motion passes. So then we will move on to item 1, and that is to review and approve the minutes of the October 28th, 2024, July 28th, July 28th, 2025, and the October 27, 2025 Board of Health meeting minutes. So it calls for a vote. So I'd like to, does anybody have a motion? Motion and a second.
Motion to approve.
Second.
So all those in favor say aye.
Aye.
Opposed?
Aye.
Same sign. It looks like the motion passes, so. Item 2 on our agenda is discussion and possible action. Staff will present a fiscal year 27 budget overview and for review and feedback. The staff report will be by Clint Welty, the Assistant Health Director. Clint?
Thank you, President Litz. Good morning, everyone. I'm not sure. Okay, there we go. Sorry. So this is just a sort of a brief, high-level, broad overview of the tentative budget that was submitted. We are, of course, still working with finance to go over some of the details. So the department consists of 4 divisions: the administration, environmental health, nursing, and nutrition and health promotion. The administrative division, we are primarily responsible for managing financial, HR, those types of administrative activities. We are also responsible for emergency response. We, under our department, the mortality review boards. We work with quality improvement, accreditation, provide mental health and substance use disorder programming, and currently we oversee the medical examiner office. As you know, that's moving in-house in the future. So a breakdown of the admin budget. I wanted to provide for each division sort of a breakdown of mandated versus essential versus discretionary project funds. So mandated are public health administration, provision of naloxone and overdose mortality review, and medical examiner services. Essential funds are child and suicide mortality and public health emergency preparedness. And then discretionary medical reserve corps accreditation and mental health and life skills for youth and justice involved individuals. We do have a new initiative submitted for the office of, for an office specialist for vital records. And vital records is also, sorry, that should have been included. Vital records is also a mandated service. So just a very broad sort of overview of the way the general funds are split up. I didn't want to get into all the grants. It can sometimes be overwhelming with all that information, so I just wanted to kind of give a broad overview. So the budget as submitted will result in an increase of around $36,000 to the general funds. This is primarily in the form of personnel, includes management, finance, admin support, and vital records. It includes internal services, and those are charges for things like IT, copying, communication, non-grant related travel. The internal services is important to note. These all get charged to the general fund account, but then they're reviewed monthly and allocated to various programs when appropriate. Supplies are just general office supplies, and charges and services are for certain travel, membership and dues, birth and death certificate paper, and other outside services. The Environmental Health Division is responsible for the routine inspection of licensed and permitted food establishments, ensuring safe food handling, working with food establishments to develop systems and protocols to ensure safe food. They are also responsible for complaint investigations for Smoke-Free Arizona Act, and in addition, mosquito surveillance and testing. The Environmental Health Division mandated services are inspection, investigation, and enforcement of compliance for food establishments, campgrounds, schools, septic haulers, those types of businesses and organizations, and the inspection, investigation, and enforcement for Public Nuisance and Smoke-Free Arizona Act. Discretionary services are the mosquito surveillance and the Environmental Health Division Quality Improvement Program. So there is one new initiative, and that's to unfreeze an EH supervisor position and freeze an EH coordinator position. So we had a coordinator position originally budgeted, and we're switching it to a supervisor. The net increase in overall personnel costs is less than 1%. Impact to general funds, there's no impact. These are funded from fees for service. Nursing Division is responsible for monitoring, prevention, and control of infectious disease, vaccinations, family and STI programs for education and counseling and screening for those programs. Occupational health program is responsible for vaccinations, TB screening for at-risk staff, so that's internal to Mojave County employees. The mobile health unit and high-risk perinatal program, which provides home visits for families with medically fragile infants. An overview of the nursing budget. So the mandated services are Nursing Services Administration, investigation and prevention of infectious and contagious and communicable diseases, mandated disease reporting, immunizations for minors, HIV screening and testing, and investigation, prevention, and surveillance of TB. Essential services would be immunizations for adults and Hep B, reproductive health, certain health screening, STI prevention and screening, TB testing and control, and the occupational health services. Discretionary are immunizations, and this is specific to the flu vaccine, and preventative health services to medically underserved populations. This is primarily through the mobile health unit. A breakdown of general funds for nursing, the net increase estimated for fiscal year 27 is just under 60,000. As with most of our divisions, the majority of that comes in the form of salaries. So for nursing division, this includes salaries not covered by grants, which it does include the mobile health unit. Again, there's internal service charges, the same as with the admin division. These are reviewed monthly to ensure that whenever possible, we can allocate those to grants. Charges and services, these are for travel expenses, for electronic medical record software, the county medical director, and certain other services like medical refuge disposal. The Nutrition and Health Promotion Division, they oversees health and nutrition programming. They manage several grants, including things like WIC, manages grants and reporting, coordinates community health initiatives, and builds partnerships to expand program reach. The breakdown of their budget, essential services would be nutrition and health promotion administration fees and the WIC program. Discretionary funds are breastfeeding and peer counseling, the Health in Arizona Public Policy Initiative, tobacco prevention, and senior nutrition programs. The net impact to general funds is an increase of around 27%. In terms of dollars, that's around $62,000. Personnel includes, and as with others, it's the majority of this is personnel. There is some internal services fees. Again, those get allocated to grants. A note: the senior program has requested the replacement of 2 vehicles. The cost associated for these is covered in the vehicle use funds and is not an additional request for general funds. And that's just a broad overview. As you know, it's budget season, and so the final budget will be presented later.
Does the board have questions? Does the board have questions or comments at this time?
Mr. President.
Ron?
Thank you, Mr. President. Clint, what is the overall increase over last year's budget?
You know what? I did not calculate that. I'm not sure.
Okay.
I can get that to you.
me.
I should have, yeah.
So are we going to present this to the Board of Supervisors, or is something else coming back to the Board of Health before it goes to the Board of Supervisors?
So before it goes to the Board of Supervisors, the official final public health budget will come to you. We will present that in is it April?
Okay.
I believe it's the April budget.
Okay, yeah, if you have that number.
Yeah, definitely. And this was I just wanted to give kind of a broad overview of things.
Okay. On that one, I think if you go back 2 slides.
I can't see, which one was it?
2 slides back, I believe. Right, it was a pie chart. I was just wondering whether the mobile health unit was under
There, sorry.
discretionary, or it was probably under essential. And for the Board of Health, mandated means that the legislature requires that we do it. Essential means that the board staff thinks it's a good idea. And discretionary, I guess they think it's a good idea, but not as great of an idea as essential. We've had some trouble, not with the Board of Health, but with Finance Department in general, letting the Board of Supervisors know what is actually mandated by state statute versus what we think is essential.
Yeah.
So that's created some confusion, and the other two are opinions, and one is law. So it's good to know the essential things are not mandated,
That's true, yes, and that's a good point.
and I don't know that makes it any clearer. But thank you, Chairman. Thank you, sir.
Thank you, Supervisor Gould. Any other questions or comments? Seeing none, I would call for a motion. So I'm looking for a motion and a second.
Move to approve.
Second.
We have a motion and a second. All those in favor, say aye.
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 Any opposed, say nay. The ayes have it. Motion passes.
A question for the attorney.
Supervisor Gould?
Thank you, President. Attorney Mitchell, what did we just vote to do, except the brief overview of the budget?
Yeah, I was kind of thinking the same thing when I was looking at it, but I think it works. It's discussion and possible action for overview, for review and feedback. You guys did that, so I think you're approving the feedback that you gave to Mr. Weltree.
But it's not necessarily a motion to approve
No.
sending this to the Board of
Yes,
Supervisors.
and that's a really good point. We're not approving the budget, so I don't know if we need, I think it's clear, but if you guys wanted to redo the motion, we can
Can
make
we
it
do the
clearer.
motion, say move to approve the report?
Yeah, it's probably better.
Yeah.
Move to approve the report.
Second.
I have a motion and a second to move and approve the report. All those in favor say aye.
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 Any opposed, say nay. The amended motion has it. So item 3 is next up. It's discussion and possible action. Staff will present a senior nutrition program for overview, and for review and feedback. We have Linda LeBeau, Nutrition and Health Promotion Manager.
Good morning, Chairman of the Board and members of the Board. My name is Brenda LeBeau. I'm the manager of the Nutrition and Health Promotion Division here at the Mojave County Department of Public Health. I'm just going to give an overview of our Mojave County senior programs and kind of an overview of some budget requests for the upcoming year. So our programs cover the senior programs in Lake Havasu City, also Kingman and Golden Shores. So just to give a little bit of background in aging in Mojave County, Mojave County is one of the oldest counties in Arizona and the U.S. as far as age is concerned. Approximately 1 in 3 residents are age 65 plus, which is far above the national and state averages of 17 and 19%. 33.8% of Mojave County residents are age 65 plus, and this is more than double the U.S. share in the census.gov data. So in addition, people are living longer. Between 2022 and 2040, the number of people who are 65 or older will more than double. So the factors contributing to Mojave County's older demographic is that obviously we know it's a popular retirement destination in Lake Havasu City, Bullhead City, and Kingman. Obviously we have lower housing costs than Phoenix or Las Vegas. And there is a large in-migration of retirees from California and the Midwest, among other places, and a limited presence of large universities or major youth-oriented industries. So what this means for Mojave County, it means high demand for healthcare services, a growing need for senior housing, could be some workforce shortages, and transportation and social services increasing. So, and especially with things like chronic disease management, assisted living, and in-home care. And as far as the workforce shortages, there may be a shrinking population with the working age. And then all this, of course, is important for our older population here in Mojave County. This is just a picture of our senior programs in Kingman, a couple of our senior program employees. So just to give an overview of our total meals served, So this is for our congregate and home delivered meal program. So there are approximately 74,321 meals served per year. That means 6,210 meals per month. And to break it down, it's about 204 meals per day. So our home delivered meals are higher, actually double the amount of congregate meals that we serve. These are the number of meals projected to be served in FY25 and 26, and obviously it depends on funding, but we are projecting an increase to 105,812 meals per served, which means about an average of 8,842 meals per month and 290 meals per day. Sorry, I think I doubled that slide. So what are the cost benefits of congregate and home delivered meals for seniors age 60 plus? So how these programs reduce overall costs is they help reduce malnutrition, they delay institutional care, they lower healthcare utilization, reduce caregiver burden, and it's an efficient means of public spending to reduce those costs. Also, benefits include socialization, reduces isolation, access to healthcare screenings, because at our facilities, we do provide information and access to certain healthcare screenings like blood pressure monitoring, activity-based wellness. We have wellness programs in our facilities, and lower per meal cost. When we have the congregate meals, it's lower meal cost for congregate meals for our home versus our home delivered meals. And this shows our ice cream social at the Lake Havasu Senior Center. They're always very well attended if we have any kind of activities that we put on for the programs. So we're working alongside our nonprofit boards to provide more senior-focused programs to address the unique needs of seniors, as well as fun activities to promote healthy bodies and brains. And then social contact at meal sites lowers depression and cognitive defects, conditions that are expensive to treat. And physical and social activities reduce fall risk and chronic disease progression. So the financial impact of the congregate meal program, this is just a table of benefits and estimated cost savings. So in regards to reduced healthcare utilization, they have lower ER visits and hospitalizations. So national studies show a 20 to 30% decrease in healthcare utilization, delayed nursing home placement. And so nursing home placement costs around $90,000 to $110,000 per year per person in Arizona, and lower per meal production costs. So we talked about that one. It costs about 30 to 50% less than home delivered meals. So for the financial impact of the home delivered meal program, the estimated cost savings to avoid nursing home placement is around $7,500 to $9,000 per month per senior, reduced hospitalizations, reduced by 23%, reduced caregiver costs, saves families around 5 to 10 hours per week of care time, and lower emergency response costs. So daily check-ins reduce 911 calls, and we provide welfare checks to those seniors who are homebound. So as far as our funding is concerned, we have a variety of funding sources. We have WACOG, our nonprofit organizations that are involved with our programs. Obviously, Mojave County, we have donations that are not required by our homebound and congregate meal participants, and then Access Healthcare Cost Containment System. Our nonprofit in-kind donations are not guaranteed, but have been increasing to assist with providing meals to volunteers and meals to support those deemed by the case managers at Lake Havasu Regional Medical Center in need of home delivered meals until a spot is opened up for them. So the nonprofit organizations have funded maintenance of county buildings and equipment. They've also helped to purchase office supplies and other supplies to support the Havasu Senior Center and the Golden Shores Senior Center. And then I have some upcoming news about our Kingman Senior Center that hopefully we will get some nonprofit assistance with them as well. So our volunteers and our staff are our most important resources. There are some challenges that exist with our volunteers covering key positions. We have some operational challenges related to inconsistent availability, training requirements, variable skill levels, turnover, service inconsistency, and limited accountability. Inconsistent staffing levels, reduced continuity of care, higher training costs per person, lower return on investment, and administrative burden. So part of our FY27 budget initiatives are for Golden Shores to change status of one part-time temporary homebound delivery driver to a permanent employment status as a senior program aide, which is a key position upon Board of Supervisor approval. Our Kingman initiatives are to partner with the Catherine Heidenreich Center's nonprofit organization for in-kind support and resource sharing upon Board of Supervisor approval. Change status of 2 part-time temporary homebound delivery drivers to permanent employment status as senior program aides upon Board of Supervisor approval, and then hire a part-time senior program aide, which is a new initiative to wash dishes and clean up duties to help keep that center clean upon Board of Supervisor approval. For Lake Havasu City, we just have 1 part-time temporary employee who is a dishwasher to a permanent employment status as senior program aides upon approval. Then we have 2 senior program vehicle capital requests. These vehicles are aging out. I did provide some vehicles, but I won't go into all the detail of that. They're on the slides. But it has been recommended by Motor Pool to replace vehicles when they age out. And so these are the 2 that are aging out. So our recommendations are for the Board of Health and for the Board of Supervisors to support the Senior Nutrition Center's budget initiatives and capital requests for FY27. And myself and our program coordinator, Susan Kokkonen, thank you for listening today and for allowing me to present this. Thank you.
Does the board have questions or comments at this time?
Hello, this is Hunter. I just wanted to make a comment that I really feel as if this program would be in alignment with the federal priorities with healthy meals and especially different innovative ways to treat chronic illness. I think that you hit, the big 3 in my mind are the socialization, the nutrition, and the physical activity, which it appears that trifecta can be supported by this program. So just as we move into the state's plan for the Rural Health Transformation Funds, I do wonder if there might be some dollars there, capital dollars for vehicles or some programmatic support, just to keep our eyes on that as a potential source of funding for innovative programs such as this.
Thank you. And I invite anybody who wants to come to the senior program to come on over and take a tour. Thank you.
Other questions or comments? Supervisor Gould?
Thank you, Mr. President. Ms. LeBeau, you mentioned the cost of congregate meals and the cost of delivered meals. What are those costs?
One is $10.75 for congregate and $14.25 for home delivered for each meal.
Is that a fully burdened rate? Does it include the cost of the facility, or is it just the operating expenses?
Right now, just the operating expenses. Also the utilities, if that's what you mean.
Okay, so it's the ongoing expenses, but not necessarily depreciation on the facility. Okay.
No.
And I don't know that we even keep it that way. Back to donations. I believe we get a quarterly report on those, and I was amazed, and I read this at the Board of Supervisor meeting. Lake Havasu had pulled in $80,000 of donations.
And I think that's atypical from this last year because they did some improvements with the senior center in Lake Havasu. They painted the inside of the building, and they also replaced the flooring, which had some bumps and some safety issues, some risk management issues. So
yeah, I think the painter donated in kind was like $30,000. There's a Salmon's Air Conditioning, Hicks Refrigeration. Gosh, I mean the cleaning crew, the landscapers. That was just awesome, and it was, we kind of just brushed that aside at the Board of Supervisor meeting. But I thought really that it was worth spending 5 minutes and going over and honoring
Absolutely.
these people for actually donating that money.
Absolutely.
So it looks like you probably need a little work on donations at the Kingman Senior Center, and the Golden Shores had a couple hundred. So it looked like they had hit up Sam's Club and Safeway for food donations.
Yeah, there's probably other donations that that the Golden Shores Community Center provides that they don't think to turn in the in-kind receipt. So,
And that one's a little different because that's their facility. They own
Right.
that building. The community association owns that building, and the county is their tenants.
right,
And
absolutely.
apparently during the COVID, we had a little problem with the tenant-landlord relationship we had to fix. But
Okay.
that being
That
said,
would-
thank you for your report.
Thank you. Thank you very much.
Thank you, President.
Okay, so Ian's questions and comments are done. I am calling for a motion. I'm looking for a first motion. All those in favor
This is
say aye.
Terry Coyle. I
Yeah,
move to
didn't get a
approve
motion yet, did
the
Oh, yes. Well,
A move that we accept the report.
recommendations.
Second.
got a motion and a second. All those in favor say aye.
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 All those opposed?
Aye.
Say nay. Motion passes. Item 4, review and accept the routine summary of select reportable diseases in Mojave County, January 1st, 2025 through December 31st, 2025. A staff report by Anna Scherzer, epidemiologist. Anna?
There we go. It should be coming through here. So our report for this quarter is actually cumulative. So it's everything for 2025 is not finalized, but it gives a good idea, a good picture of some of the patterns that we had out there. And as usual, we have a comparison between last year, 2024, and then this report, 2025, the 5-year median, and then I always like to put in the number that we actually investigated to get those end counts of confirmed and probable cases. And so a couple things that I do want to point out that will not be news to you are the vaccine preventable case counts for measles and for pertussis. In 2025, both of those shot right up. And I expect we're going to have plenty more measles in 2026 and maybe a little bit more pertussis, but I hope that that'll slow down at some point. And you'll notice we had higher than normal salmonellosis cases. We did have at least one outbreak that I can recall. There wasn't a huge case count, but did have some cases that contributed to that. And the rest of the cases weren't really linked to one another or a whole lot of anything else that was out there. Influenza and the respiratory viruses, you'll see a little bit more on the flip side when we get to that point there. But one thing I did want to mention around the holidays, when there was a lot of media attention that was given to a new strain, a new clade, a new type of influenza that was out there and perhaps making more people sick, or more importantly, was escaping the vaccine because a vaccine wasn't necessarily a good match for it. And that was the K clade of influenza A, H2N3. And all I can say is we don't get down to the nitty-gritty details of the K clade in our surveillance system, but it is normal at this point in the season early on to have lots of influenza A as opposed to influenza B, which is what we're seeing. There are some surveillance systems where providers, especially the hospitals, can take a subset of swabs from folks that are going through their ER or folks that are hospitalized or whoever they choose. If it's a positive influenza swab, they can send it to the state laboratory, and the state laboratory can do a little bit more specific typing. So they don't get as far, at least as far as I know, they don't get as far as to that K clade, but they can tell you if it's influenza A H1N1 or influenza A H3N2. And indeed, we do have a good handful of influenza A H3N2. Don't know if it's a clade that folks were talking about, but I haven't heard a whole lot more talk from infection control preventionists at the hospital or anywhere else that this year, this season is alarming, or we're setting ourselves up for something that could really blow up. So I think influenza is just kind of being normal old influenza at this point. And the flip side of the paper there, you'll see that we have a little bit more information on the measles outbreak in the Arizona Strip, the Colorado City area. And then also down at the bottom, there's your respiratory virus activity. And I think I pulled this sometime last week to put this report together. If you don't see it in color there, if it's all coming out black and white, the top line with the big spike there, that's influenza. And so you can see around the holidays, specifically around Christmas and New Year's, that's why it was in the media and people were talking about it, is because we were seeing a lot more influenza. The middle line in there is COVID, so it's a little bit more stable in terms of the case counts we have, and at the bottom it's RSV. So nothing too terribly surprising there. It doesn't mean that our big spike is going to be here as it's seen in this picture. There's still plenty more time. And if you look at the case counts over there on the left, that's not a really big case count. So let's get through March, April, and then we can see in hindsight what's really going on. And the measles outbreak, again, the summary that's there is from last week, and so things just keep going up, slowly up, creeping, and it's going to persist for a while. In short, we have well over 200 cases just on the Arizona residents, and I do believe that they have identified some folks in other states that are linked to the outbreak. Of course, Utah has many, many cases, so there's still plenty of activity going on out there. We've had so far, at least when I put this report together, there were 11 cases that had been hospitalized. None of the cases that were hospitalized had been vaccinated. And overall, about 97% of our case patients, so of those 200 plus cases, about 97% were unvaccinated. And that's all I had to report out there. I don't think it's anything too surprising.
Thank you, Anna. Does the board have questions or comments at this time?
I have a question, President Lentz.
Carolyn?
Ms. Anna, so did I see that right, that we had did we have a TB outbreak, that the case number was 42 from this past year?
So that column over there, that's how many reports we get. And when the nurses investigate and carry through and follow up, there were actually none that were active TB cases.
Okay.
Yep. So that's all the work in the background that goes into getting that case count of 0.
Gotcha. Okay.
Yep.
Any other comments?
Yes.
Supervisor Gould?
Thank you, Mr. President. Anna, do we ever test that measles that we're seeing in Colorado City to see if that was the Mexican version of measles?
I have not heard. I've asked a lot. There is apparently not a great push to do that. And I don't know why that's the case, but they're kind of backing off of necessarily linking everything together, and I don't know why that's the case. Certainly, they're linking what's in our outbreak together, but beyond that, to look and see what's happening elsewhere or how it was introduced, they haven't determined that.
It's interesting because I think that would be beneficial.
Absolutely, yeah.
Just in general. Hep C, is that not reportable?
It is reportable. However, it's reportable to a different system, and it kind of goes outside our health department nowadays. It's been several years. Huge counts there. That's a very common.
Thought it was interesting. Is it Chingis disease? Is kissing bug disease? Yes. So we have none of that, which is good.
Well, we have none in this report, but we have had cases of Chagas disease. We have had insects that are the ones that can carry the disease. We have had I believe an insect that actually had the disease in it, because we can test for all of that.
A couple of years ago, we were cleaning under our bed, and I found this weird-looking bug. So I took it to a guy that I know at Havasu Pest and asked him what this is. He had no idea what it was, and he goes, "I'll find out though." And about 2 weeks later, he called me, and he still hadn't figured out what this thing. But it looked like that bug that spreads that disease.
It could be.
I just thought it was odd. And our cats used to come and go. And after they brought in a rattlesnake, we decided they were no longer coming and going. So they're outside cats now. But it was just kind of a weird looking bug. And it looked, when I tried to take a picture of it and searched it, it looked like the bug that spreads Chingus or whatever it is.
Unfortunately, earlier this year, we had somebody who called the state health department saying that they had a bug. They thought it was the carrier, one of those bugs. And state health department turned their information over to us, and I could not get a hold of them. But I would have loved to have collected that bug, and I think it was in Lake Havasu area. Get it typed, get it specified, and they can actually look at the DNA inside the bug and see if it's infected with Chagas.
If I get another one, I'll bring it in
Yes.
for you.
Yes.
I won't bring any snakes, though. Thank you for your report. Thank you, President.
Does anybody else have a comment or a question? Okay, hearing none, I'll call for a motion.
Motion to accept the report.
Second.
Okay, so moved. All those in favor, say aye.
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 Any opposed, say nay. Motion passes. On to item 5. Next would be a presentation of the Mojave County Department of Public Health Strategic Plan Overview by Clint Welty. Review the department's strategic plan presentation and provide recommendations regarding the proposed fiscal year 27 and fiscal year 29 strategic strategies and objectives. Clint.
Chairman, members of the board. So we wanted to give just a brief overview. It seemed like end of 2025, beginning of 26 was a good time to give an overview of what we've been doing for the strategic plan and what we plan to do moving forward. Wanted to start just as a reminder of what our vision and mission is. It's to healthy people and healthy communities. The mission is to promote, protect, and improve the health of all communities. So the strategic plan is a document, a department-wide document that helps us to set direction and priorities, guide decision-making, ensure accountability, promote collaboration, and adapt to emerging needs. So to do this, we have a lot of sources that we try and bring together, those that influence the strategic plan. Those include laws and ordinance and regulations for a lot of our mandated services. Those include grant and funding requirements, the community health survey and focus groups. I think we've done several presentations on the data from those, community partners, and other stakeholders. And so we try and bring those together into a strategic plan, and for the purpose of guiding budgets, performance measures, annual work plans for staff and programs, all sort of feed out of that strategic plan. So in FY26, we formed a strategic planning work group that involved staff members from various levels of all divisions. We developed a data collection system, and we're sort of testing out a SharePoint dashboard. Right now that's only internal. We're trying to work out the kinks and get it ready for possibly making it available to the public next year. And so to the right of the screen is sort of an example of one of the metrics we use. And so Aspire curriculum is an anti-smoking curriculum targeted at youth. And so for this year, the target is to maintain a completion rate of 75%, and so we're reporting out quarterly. I don't have quarter 2 yet, But this is the kind of stuff that will be that's on the SharePoint that we'd like to share out to you all in the public later. So for upcoming strategic plan, as I said, we took input from various sources. We've developed, forgot what it's called, developed some strategic measures. These were sent out to you all, I believe, in November or December. So we're in the process of getting stakeholder feedback, including from the Board of Health. The idea is to take this feedback and sort of refine these metrics and objectives, develop goals and action steps for those, and then start reporting those out. So, again, it's just the strategic plan just provides us with guidance and direction to ensure that all programs and activities in the public health department are in line with our goals, with the goals of elected officials, with the goals of the community, et cetera. So, any questions and feedback?
Questions or comments from the board at this time? Commissioner Gould.
Thank you, Mr. President. Deputy Director Welty, how do you fail the tobacco education program?
Some students drop out, and some just don't pass the test. I mean, there's a testing portion to it, and
So did they put one class on a year for a particular grade? How did they do that?
It goes throughout the year. So it's nutrition manager LeVou may have a little more detail than me. I don't oversee the program, but it's for students who are caught smoking or vaping in the schools, and so they get assigned to this program, and so the program sort of runs continuously throughout the school year. And so you have students sort of continually entering it, and then as they pass all the coursework, then they, complete and move on.
So it's similar, like cigarette detention, essentially?
Yeah.
Okay. Interesting. When I was in high school, we had an area called Marlboro Country. They actually, in California, if your folks would sign for you, you could smoke on campus. This was I graduated in 1978, and it's just bizarre that, but the best thing about Marlboro Country is if you wanted to hop out it was easy to jump the fence from Marlboro Country into the outside world to go get lunch off campus, and then you could hop back into Marlboro Country and go back to school. But,
not that you did that, of course.
I think the statute of limitations on restraining Supervisor Gould into a closed campus have expired. But times change.
Yeah.
Interesting. It's probably better that we don't allow children to smoke on campus.
Yeah.
Thank you, sir. Thank you for your report.
Thank you, Commissioner Gould. Any other questions or comments at this time? I just have a comment myself. I recall as a young man here, probably 6 or 7 years old, being at the hospital with a lung problem, and the doctor was actually smoking in the hospital with a cigarette in his mouth while he was listening to my chest. Right, Commissioner Gould, you're right. Times have changed.
Your mom was probably smoking out in the waiting room while she was waiting for it to come out too.
Could have been. So, being there's no more comments, I'll call for a motion.
This is Terry Coyle. I make a motion that we accept the proposal.
Second.
Got a motion and a second. All those in favor say aye.
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 All opposed say nay. Motion passes. Okay. We're on to item number 6, and this would be the time where we're looking for comments and requests for agenda items for the next meeting. Supervisor
This is
Gould.
Hunter. I have one. It speaks a little bit to the measles outbreak. So for those of you that don't know, I'm the CEO at Creek Valley Health Clinic. We're a federally qualified health center that serves the Colorado City area. So I think I think the vaccination efforts from our team as well as the Department of Health have been pretty incredible over the last few months. I do feel like maybe some ideas around like some public education or even information clinicians can use when having the measles discussion. I know just the ripplings through the community are still very much, on the homeopathic vitamin A, vitamin C remedies. And I think where there is a time and place for that holistic style of care, I think that looking to the Department of Health for just more information and education on both short-term and long-term effects of measles could go a long way.
Very good.
And maybe speaking about the homeopathic remedies, I think if there was a representative from the Department of Health that said, okay, if you are stuck at home with kids with measles, are there some options that might reach the community that does, refuse the vaccine, which I want to respect everyone's choice in that, but I do think maybe just having some public information could be helpful.
Thanks for bringing that up. I have a comment on that. In terms of vaccination and recipe regimen to help the patient and citizen of the county, a lot of time I think it's come down to we can create environment where the patient, the client have option to discuss with the healthcare provider. Technology allowed us to do a lot of this virtually and remotely. So counseling, go back to the principle of, patient-doctor relationship or healthcare provider. It's required conversation. If you can sit down 5 minutes to discuss with the individual the reason why and have option to discuss, I think a lot of time is the information is more informed, the decision-making is more informed consent. So I think that's the best way to go about. So we should try to leverage our technology to provide that aspect for our patient or our citizen for the county. I think that's helped a lot. It's ultimately, with all the confusion going on, I have so many phone calls to the office, myself as a pulmonologist during the winter season. I say, why don't we set up a quick telephone visit or a virtual visit? And usually that's beneficial for both, for the provider and the patient. That's one approach. There's many approaches. And again, I myself believe in homeopathic, but Western medicine's here for a reason. Just a comment.
Well, and I like that perspective where you can, it's not, this versus that. There is an area where you can have both. And I think that the Department of Health, I think that it's expressed, the best option is the vaccine to prevent measles, but also what are other options? What is the other education? What is the other approach? Because if someone's ears turn off to option A, you're exactly right. How can we as the providers and in those face-to-face meetings and when we're talking with a mom with 5 kids, what are other options that we could provide from? And I will say the health department has a lot of trust and a great reputation in the Colorado City community. And so I did want to just say kudos and congratulations to the team because this outbreak, as well as COVID, I think demonstrated a great level of trust with the Colorado City community that may have not been there a decade ago.
Outreach and using leverage technology we have is a great for our county. Our county is large, and a lot of time you had to report, face to face. You can have the meeting. This technology didn't exist 10, 20 years ago. You have to meet the person in person, but here it's available. And when you have a conversation with someone over the telephone, with the video conference, is always helpful. That's one of the many ways that we can, help out our citizens. And I'm available if someone need to. You can never convince 100% everybody or discuss about it, but you hear out a reason why certain person have a objection or hesitant about the treatment, because there are side effects of the therapy. We know that. And it's, for me as a clinician, it's weigh out risk and benefit of the treatment. And ultimately the patient, the client is the final decision making.
Okay, thank you for the comments, Hunter and Dr. DeGuin. Supervisor Gould.
Thank you, Mr. President. I don't see the harm in bringing information forward to the public on measles. the effects of measles, how measles is transmitted, and anything that people could do to make them less apt to catch measles or suffer worse while they have the measles. So I see no problem with bringing that forward to the board. Thank you.
Thank you, Supervisor Gould. Anything else for the good of the order today? Hearing nothing, I would entertain a motion to adjourn.
Second.
I got a first and a second. All those in favor say aye.
Aye.
All those
Aye.
opposed, same sign. Okay. Motion passes. We stand adjourned.
Thank you, everyone.